Dear attendees, we are continuing with the second panel on acute medical treatment of patients with severe burns. The acute treatment of burns is one of the biggest medical challenges and requires an adequate response of all healthcare institutions and medical personnel. That's why I would like to invite the panel, Mr. Dr. Stojanovski, Director of 8 September Hospital, Jasmina Gergievska, Director of the Plastic and Reconstruction Surgery Clinic, Maria Srceva, anesthesiologist at the Clinic for Trauma, Reanimation and Intense Medical Treatment. Elisabetta Obočki, Plastic and Reconstructive Surgeon, University Clinic Svetina Ohridski, Dr. Jonic, University Clinical Center of Serbia, Dr. Krisagi Genaki, Intensive Care, Medical Doctor, Papa Nikolaou Hospital from Greece, and Director of the Medical Clinic and Hospital in Stipa. Distinguished attendees and attendants of the second panel, prior to starting with the topic of what this second panel is going to discuss today's conference, I would like to extend my condolences to all the victims of this terrible tragedy that took place exactly a year ago. The idea of this panel is to focus on the medical response and everything that took place at this tragical morning, and the way our healthcare institutions were operated, and in what manner the medical healthcare managed to give their best, both in the coordination and cooperation, and also in the triage and the medical treatment of the injured, selection of the injured to be sent out to highly specialized centers throughout the European countries when dealing with mass casualties and injuries with burns. Our selected panelists come from the healthcare centers and hospitals that gave the first response in the early days of the tragedy. So I was a witness of a selfless collegiality, mutual support, collaboration and assistance, and it was a proof that the healthcare system can indeed operate involving all of its capacities, and the proof of this was this tragedy that united us all, and it helped us learn about each other, how we should get prepared on daily basis, and how we can strengthen the healthcare system in terms of preparing a national strategy of preparedness and response to such incidents. This panel is going to focus on the first response of the medical institutions. We are going to discuss the acute treatment of the patients. They had normally 3 types of injuries. So they had trauma, they had burns, and inhalations of toxic gases like CO2 inhalations, which patients should have been allocated in which hospital, and also transport of such patients in the highly specialized institutions outside of the country, and what are the lessons learned out of these incidents in the sense of preparing our healthcare systems for a potential future tragedy or maybe an incident with a massive incident with a large number of casualties. So that would be the topic of this panel. I would encourage that this discussion is interactive, and I encourage the engagement of all the participants on the panel. So, Dr. Srceva, you have the floor.
Let me first of all express my condolences to the families, the entire country, for the loss that we suffered. Unfortunately, it is almost a year after the event, and it's still difficult to talk about it. And whenever I do talk about it, I talk like a mother, as a parent, as a daughter, as a professional, and as a human being. And I still feel this bitterness in my soul when I talk about it. This is a tragedy we can never forget, and it's deeply rooted in our memory. Yet the response to it will be something that will stay with us throughout our lives and will be with us in the present, in the future, and something that future generations will be able to learn from. Let me focus on several aspects, one of them being the human one, and that was shown in this widespread pain that we all felt. But as medical professionals, we have this obligation not to be prejudiced, but be constantly aware and down to earth so that we can put our experience into saving lives. Let me first of all say something about the primary triage that was provided at the Mother Teresa Clinic and the emergency center, and then their treatment in intensive care units, the challenges the patients faced while being subjected to intensive treatment, the crisis headquarters, the coordination between the clinics and other healthcare institutions, and of course, lastly but not least important, the transport of patients following the first call we received. We were quick to organize, firstly at the level of the emergency center. All patients treated at the surgical diseases clinics went through this emergency units where they were triaged by 3 anesthesiologists and a plastic surgeon and a trauma specialist. Knowing the pathophysiology of these injuries, we of course know that they can vary, as you said yourself, but the type of treatment of this patient depends largely on where the location of the injuries, what type of injury it is. Is it isolated, how stable or critical the condition of the patient is, but the difficulty and the severity of the trauma will leave us with no additional time to react to severe cases when we have to respond quickly to stabilize these parameters, and we can work with the patients. Based on our knowledge, medical knowledge, the triage that took place, that was provided in the emergency unit, involved the most critically affected patients, and they were subjected to intensive care in other clinics, the plastic interventions in surgery 1 and the pediatric surgery clinic. Physiology is something that, because of which we do not know how the situation of the health condition of the patients will develop. We have these mobile teams that actually help to treating patients in both the clinics that are. Second of all, I want to say something about the treatment of the patients in the clinic for those who during the first aid had the biggest chances of achieving results in this initiative. We engaged 8 specialists, 12 residents, and we had, of course, secondary personnel who all helped in the treatment of these patients. This is my clinic where I have worked for many years, talking about coordination and interaction. What I can say from an emotional perspective is that at those moments, the clinic for reanimation and intensive care, together with the nurses and the assistants and technicians and other medical staff, were all acting like one. It's not only that their knowledge they put into the efforts, but their souls and hearts. I feel the urge to personally thank them and convey this feeling that when I talk about this, I'm talking about a family that seeks no recognition but deserves deep respect. The patients that were treated at the intensive care clinic in line with the protocols and the intensive care rules were all subjected to complete hemodynamic monitoring, and they were giving urinary catheters, and their gas exchange was also monitored, whether they have been intoxicated by carbon monoxide or other agents, and of course intensive resuscitation with liquids on top. All of patients treated in this clinic were also subjected to a URL and colonoscopy to assess the percentage and type of injury, whether it was burns or upper or lower inhalatory tracts. Let me just say something about what was happening at intensive care in parallel with all these processes, with the plastic surgeries and the pediatric interventions was taking place hand in hand and in coordination with the crisis headquarters that included members of all hospitals in Skopje, by representatives of the Health Insurance Fund, many physicians that I would like to also extend my gratitude to, my colleagues at the other clinics, and all the people in charge of coordination on part of the Prime Minister's office. And throughout all these activities and in coordination with the crisis headquarters, actions were taken in cooperation with the doctors at the clinics and all hospitals in the country, so that everyone is aware of what the treatment is. And of course we were making decisions about the transport. This transport decision depended on the urgency, on the type of trauma suffered, and of course the possibility and capacity of the civil protection system and the hospitals that are to admit these injured patients have the capacity to admit them, whether the equipment they have is suitable for the patient. So each individual patient was selected and referred to the appropriate healthcare center in coordination with the crisis headquarters. We, of course, had patients that suffered injuries and were treated at the orthopedic clinics. 12 of them were treated at the toxicology clinics, and that is the Mother Teresa one. And I hope I'm remembering this well. One of the patients was admitted to the ophthalmology clinic. The transport, as I said, was coordinated together with all hospitals involved and the crisis headquarters, and patients were sent abroad on the basis of their trauma and along with documentations of their treatment and current health condition. In addition, patients were subjected to protocols issued by the Ministry of Health, and we had to follow these protocols and all these checklists that gave us a precise and clear indication what their injury is, where they were treated, and what kind of treatment. Of course, we also played a significant role in their return from hospitals abroad, because when we transported patients abroad, we also set up a team of anesthesiologists, a pulmonologist, a toxicologist, a psychiatrist, an ophthalmologist, and otorhinolaryngologists, and they were all there, assessed the condition of patients as soon as they came back from abroad.
I would not be so extensive in terms of this aspect, but I would like to point out another issue. The first patients that were taken abroad were then taken back on the 23rd of July. So those that were sent out to foreign hospitals were the ones who were returning first. The first patient that came out from the clinic for intensive care and anesthesiology, he came back in August. I don't know the exact date. So how can I put a closure to all of this process without emphasizing that the coordination itself and the mutual human interactions and the humanitarianism play the great role in this. We have seen it on the ground, we have seen it in place, we've felt it on our skin, but we have felt also the pain and the unrest inside of us, because the medical sciences does not allow us to deal with internal pain, because we are professionals. We have to attend to the needs of the patients. And they say another proverb, 2 countries, 1 common pain. This is a proverb that is used for countries that have mass casualty incidents. It refers to town, community, cities where the pain is felt across the community, but they are uniting in the pain and they are offering a helping hand to each other. We have seen on the spot the humane aspect of our medical doctors, the very quick and adequate response. We have faced not only the pain, but also with the implications of that pain. The pain does not know any borders, but humanity does neither. We should remain humane. We should always offer a helping hand to each other, and we should never forget the helping hand that helped us when we needed most. Needed it most. That fatal morning, the most of the hospitals received instructions to mobilize their medical personnel, although we received information that it was a great tragedy. We were not aware of the scales of the tragedy. We realized very shortly that it was a large-scale tragedy and that all the hospitals that were involved will be put on a test. So Dr. Vlatko, as a director of the clinical hospital in Štip, was the first to be exposed to these news and information. So how was the first morning? I would like to extend condolences to the families of the victims and lost lives and to support them in the times of sorrow. For us at the clinical hospital in Štip, as the largest regional hospital in Eastern Macedonia, we were the first clinic to be exposed to this tragical event. The event started at 3:20 in the morning, where my colleague Christina called me and said that there's a big fire, outbreak of big fire, and that we should get prepared. So that in the next moments, we started receiving immediately the first children that were injured. So what everybody's mentioning, good coordination and good triage, allowed, thanks God, not to lose any lives in the initial stages until by 3:30 I was at my work, and I had immediately contact with a representative from the government, Mitrev Trambozov, and the emergency headquarters was already established. About the scale of the impact that clinical hospital in Štip has experienced, I can say that in the first 60-70 minutes we had 40 patients that arrived, so we put them in intensive care. I have to extend thanks to all the medical personnel, anesthesiologists, medical doctors, then paramedics and nurses have responded to the call for help. So in the first hour, we managed to set up 10 medical teams, and we have provided the initial triage. So we start putting the IVs and then analgesics and then doing the treatment. And we had the coordination with each and one of you, with the other hospitals, to transfer the patients that arrived in the medical clinic in Štip. I have to also extend my gratitude to all other directors of the local hospitals and clinics that send their and outsource their medical personnel to the medical clinic in Štip and arrived as soon as possible to the clinic in Štip. So in the first 45 minutes, we started transporting our patients to the tertiary healthcare system and the Mother Teresa Hospital. As you have noted, the patients that were lightly injured were sent out first because we wanted to hit the ceiling and allocate first the patients that had light injuries, and then according to our strategy, then we were sending out the more severely injured. So the first 6 hours, the dynamics were mostly focused in our clinic in Štip, and then this dynamics was transferred to the other hospitals throughout the country. We had 49 admissions of 49 patients that were treated with heavy medical history, with the coordinator Merjanovski, with the director Klekovski. We were sending out the patients as it was agreed with you in a synchronized manner. So in the 8 September clinic in the capital and other hospitals. So by the 1500 hours, we had only 30 patients with severe injuries, but they were in a stable condition. So with your agreement and coordinations, we received instruction to bring all the patients, and by 1800 hours we mobilized all the patients, and in 2200 hours there was no single patient in the clinic in Štip. So these were 49 patients that were treated, and another number of 120 that we sent additionally. So the clinic in Štip conducted an excellent triage and medical treatment of the injured that allowed all the other medical hospitals in Skopje to receive a timely information of what kinds of patients will be sent out, what is the seriousness of the injury that proved the functionality of the systems, and the health institutions that they help unite all these medical institutions together. What the medical personnel faced when the patients arrived to the hospitals in Skopje, as Dr. Srceva mentioned in her presentations, after these patients were triaged, they were distributed and allocated to the wards that were in the different hospitals. In the first instance, our plastic surgeons were engaged. So I will give the floor to Dr. Obochki to tell us how this first day of the triage looked like.
Good day to you all. May the deceased rest in peace. That morning, on the 16th of March, we were summoned by the chief of the on-call team at our clinic of St. Nom from Ohrid, 5 plastic surgeons, Dr. Atanasova, Dr. Stevkovska, Dr. Shapova, and 5 Dr. Gruev, as well as 3 residents, Dr. Šojle, Dr. Rajkovska, and Dr. Arjanova, in coordination with our director, Dr. Nastov. The entire top-notch team of our anesthesiologists were called. Our operation rooms were completely prepared. Our surgery nurses, medical nurses, and our departments and wards. Within 1 hour and a half, about 30 patients were admitted to our clinic through a quick triage. 15 patients were received in ICU, and 11 for the child and plastic surgery and urology ward. So a careful and quick response of our anesthesiologists, where not only burns were identified in these patients, there was an additional injury as inhalation and intoxication. The first surgical treatment of quick surgical treatment of all patients and assessment of the burnt surface areas at the patients aged 17 to 47 with a percentage of burnt area depending on the etiological factor. Deep burns between 7 and 40%. With urgent fasciotomy in 2 patients where burns of functional organs were identified. 10 patients were addressed with urgent ischiotomy. Huge gratitude to all the team of doctors who immediately examined the patients, by traumatologists, neurosurgeons, rheumatologists, internists, and anesthesiologists, and quick and adequate response by a clinical ophthalmologist, pulmonary doctor, toxicologist, and psychiatrists. huge and speedy response by the government, the clinical team of experienced physicians from the clinical center of Mother Teresa, to teamwork headed by our director, and great gratitude and respect to all neighboring countries and countries from the EU for transferring the most critical patients to the neighboring specialized centers, burn centers. Once again, I wish to extend my huge gratitude and respect. In the following 2 weeks, our clinic was a burn center for 11 remaining patients. We wish to thank the Israeli team sent to assist us where they accessed with the treatment on the third day of the injuries and our engagement for early excision and covering with auto transplantants of the operational parts of the bodies, hands and palms in 6 patients. Huge support by the entire medical staff and medical nurses, nutritive support, psychiatric care, huge to the Institute of Public Health with their regular microbiological analysis and testing, and through their daily care, our patients, through the quick rehabilitation, we managed within 1 month time to send them home. However, the returned 3 patients were also treated through intensive skin grafts regarding the remaining burns, because burn treatment requires very quick moves that may save lives. Teamwork and speedy response by the government and the expertise saved young lives. They saved the future and the dreams of people. My fellow colleagues express their gratitude by attending the congresses in Belgrade, Berlin, Salonika and Ankara. Thank you very much for the entire help and humanity you showed. Thank you. Triage of patients that morning was indeed very complex, because in addition to the level of burns, oftentimes patients had fractures. Very often they had the need to be put on respiratory support and intubated. In the entire confusion, I may say that the institutions indeed had excellent communication, and specifically at our hospital, the entire surgical team of plastic surgeons was put at disposal. Dr. Yasmina and her team from the University Plastic Surgery Clinic selflessly offered. This interinstitutional collaboration allowed for an adequate initial treatment, and then after that, the patients having the opportunity to be treated on our hospital premises to remain, and the ones with more severe injuries to be transported to the burn specialized centers, be triaged in time and sent over there. Dr. Yasmina. Greetings to the attendees. May the deceased rest in peace, and I wish to give the strength and power to all the people who've been through this tragedy, for their courage, for the strength they find in their hearts. I apologize for this. That morning, Dr. Marjanovski called me after 3:45 when he said that there was a huge tragedy taking place, huge fire, that we do not know how many injured were affected. In 10 minutes time we went to the hospital, and in the meantime, by calling our colleagues in order to equip the teams, most of the medical staff. About 50% were at their workplaces within 30 minutes time without asking what and how to do it. And more than 90% were on their workplaces in less than 90 minutes, in less than 60 minutes, sorry. So once I arrived, we immediately, as plastic surgeons, what do we see in terms of burns? First, we identify the parts of the body burnt in order to approximately assess how much of the skin has been injured, how deep the burn is, which parts of the body have been affected, if they inhaled or not. Most often we saw facial burns, dorsal, hands and back burns. And what I established as a plastic surgeon was that clothes were not burnt in those children. They had areas burnt that were open, that were in touch with either an agent or heat or any substance that made these burns of the second or third degree or even higher degree than that. Through the triage and through the quick escharotomy, I think that those children received the chance to keep their limbs, their hands vital, and this quick assessment, who should do what, the teamwork, collegiality, made us so quick and expedient with that many survived children. Quick triage is most important, especially regarding burns. What Kočani Hospital has done and Štip Hospital has done for those children to reach our institutions is of huge importance. And I wish to extend my respect for that. We as an institution, just like we are thanking the entire medical staff, both medical and non-medical staff that were with us without paying attention to the time, but only caring how to save those children. I wish to point out that children were losing their consciousness quickly and resuscitation would take place then. I initiated the name writing on the children's bodies because they didn't have any personal identification. Their name and surname and date of birth contributed also to their quick identification and transportation to the other countries. I wish to thank Papa Nicolaou for very early, about 8:30, was contacted by us personally. They immediately proceeded as colleagues and as neighbors to help us in this situation. I'm thankful for that because we do have protocols, but they were all in Macedonian. The speed through which their protocol was handed over to us took those children with the adequate documents outside of our country. And each sheet had on its top Papa Nicolaou title. I wish to thank all of you, all the governments engaged and accompanying us at all points in time to handle this disaster for us, for the entire Macedonian people, that will remain as a really tragical event to be remembered for decades. But also, there was a lesson in all of this tragedy. a nice positive aspect of how to be team players, how to be humane, how to approach situations like this. We will remind ourselves for many years to come of all of this, but we also learned a lot that we can stand unified and turn into one, and friends can be seen when it's most difficult. Thank you all for being with us.
It is a fact that in the first 24, 48, 72 hours, the entire medical staff from paramedic, doctors and nurses have selflessly engaged themselves and put in the function of saving the injured. So they were not even thinking of going back home. They were present all the time and they gave their best in that sense. We had a great support from our colleagues from the medical center in Belgrade, and after the initial triage in the first 72 hours, they came with our teams into the operation hall, and they immediately engaged themselves in the interventions and surgeries, and what was done in the first couple of hours contributed to the fact that a large number of this injury do not end up with disability, a long-lasting disability. So, Miss Dr. Vadium.
Everyone, I will speak on English. I want to say before I start a few things you mentioned before, but I will tell again. Well, I am Marko Jovic. I am plastic and reconstructive surgery. I work in the clinical center of Serbia at the Clinic for Burns, Plastic and Reconstructive Surgery. And I must say one thing, that I'm very glad because my state, Republic of Serbia, had the opportunity to help Macedonian state, to help Macedonian people, citizens, and at the end, the patients. And we are very glad because of that. And I must mention one thing more, that we admitted 30 patients from North Macedonia, and that is the more of all countries you mentioned before. Only my hospital, Clinical Center of Serbia, admitted 17 patients, and that is also more than any other country admitted patients from Macedonia. And also I'm very happy and very, very glad because you invite me and you invite me my colleagues also, and it's a big honor for me to be here, to be with you, to be here in Skopje, in Macedonia, with all of you, and thank you very much on that. Yes, it's true. We sent our military Air Force, sent airplane, transported airplane, military airplane, and we picked 70 patients in 2 times. And we admitted, like I said before, 70 patients in clinic for plastic surgery, and the good news, they all survive. If you talk about, you ask me about our, and that is the focus point here, but I will tell something more. How we organize, how is national reports, our national reports to burn injury, and I will say a few things if you allow me. Our national response to burn injury is organized through network or different healthcare institutions. I mean local healthcare institutions like local hospitals, and 6 main. That is Clinical Center of Niš, Clinical Center of Novi Sad, Clinical Center of Kragujevac, Clinical Center of Ćuprija, and the main two, Military Medical Academy and Clinical Center of Serbia, as a crown of this network. So these four centers, like I mentioned before, Niš, Kragujevac, Ćuprija, and Novi Sad, they treat burns below 30% TBSA. Above 30% TBSA, treat only Military Medical Academy and Clinical Center of Serbia. Why? Because we have very advanced infrastructure, we had very advanced space conditions, we have very good equipment, we have highly trained team of plastic surgeons, we have multidisciplinary team, and so on. I will tell a few facts about that, about my clinic. We have 70 beds only on burn department, where I am chief of that department. We have 7 beds in intensive care unit, with the possibility to exceed on 17 in any time if some tragedy occurs. We have 10 beds more. We have 2 operating rooms, aseptic, septic, good availability of skin donors, of coma transplantants, good equipment, and so on and so on. And that is the reason that we can manage the most severe burns in our country and also in region. I will mention also one thing, that we have a good agreement. The Clinical Center of Serbia had a good agreement with Health Insurance Fund of Montenegro and Bosnia and Herzegovina. I'm in Republika Srpska, so we have patients from that country, and that is not big number, but we have a few during the 1 year. And that is some fact about how we organized and how we answer to burn injury in Serbia. If we focus what we exactly do, well, if some patient admitted to, like I told before, some regional hospital, local healthcare centers, they try to stabilize the patients, they try to prevent burn shock, they try to control pain, and also they can do initial wound manage, they can circulatory resuscitation do, something more, but when they stabilize the patients, they send patients to these 6 or these 2 medical centers, and we treat them with the very good results, with the European average, and we are very happy because of that. And also, it's interesting that we follow recommendations of European practical guidelines that was created by European Burn Association, and our protocol is aligned with that protocol, and maybe is that a reason why we got a very, very good results.
Благодарам, доктор Марко. Благодарам и за целата безрезервна поддршка.
Thank you for the entire unreserved assistance that you provide here on site, as well as for those that were transported, and all the levels of healthcare where they were provided with professional health care. This will be one of the conclusions of this panel, the organization and setup of the health institutions in the healthcare system in cases like this, in terms of which patient is to be transported where and when, and what health care they can obtain and receive. In the first initial health response involved the patients that were already critical in the very first hours, and our colleagues in the intensive care units, both in the surgical and internist units, invested their best efforts to act in line with the rules of acute medical care for such types of trauma and disasters. And a large number of the patients had to be placed on respirators and accommodated in the intensive care units.
Papa Nicolau Hospital was one of the first hospitals that admitted one of the injured patients, so we would be very grateful if you share your experience with us, with the extent of the injuries and the severity of the injuries of the patients that were admitted at Papa Nicolau Hospital. Thank you.
Dear audience, on behalf of all my colleagues from the Berna ICU unit of the General Hospital of Thessaloniki, Georgios Papanikolaou, I would like to address our deepest condolences to the families of the victims, and of course to thank you for this honorary invitation. I am an anesthesiologist intensivist. I work in the Berna ICU unit in Thessaloniki. Our department is certified since 2024, and in full capacity we can work with 6 beds. It's the only one in the northern Greece. The other 3 are in Athens. That day, on 16th of March, we received a call from the National Health Operations Center regarding the availability about Berna ICU beds, so we could help with the victims from the Kotsani fire. Our chief directors, Dr. Athina Lavrendieva, which is the chief director from the first ICU unit, and Dr. Sofia Papadopoulou, which is the director of the Department of Plastic Surgery, were immediately informed. And as I know, the personal communication with the hospital of Mother Teresa Hospital had already started on a personal base. And it is impressive because in 14 hours after the accident, 3 young patients were already transferred to our hospital. All of them were intubated, mechanically ventilated, and of course under medical supervision. They all suffered thermal burn injuries on their necks, faces, heads, scapular areas, and upper extremities, from 15 to 25%. One of them had 3rd degree, approximately 6% thermal injury. And of course, also they have suffered inhalation injury due to the exposure to fire in a closed space. Upon the arrival, all of them were taken to the OR, the operating room, so we could do a more thorough wound assessment, and the surgical debridement and use of enzymatic therapies also take place either were needed. I would like to say that we had already in our hands preliminary clinical data from you after completing this form that you have, and we ask for our colleagues to send us before the patient comes to our hospital, so we know what has already happened till the time of the patient. 2 of the patients were, the following days, all of them received full body CT scans, so we would be sure that there wasn't some injury that we didn't know. and 2 of them were undertaking tracheostomy. One of them, the female one, the 19-year-old, I won't refer to the name, due to refractory metabolic and galactic acidosis, despite the adequate fluid resuscitation and hemodynamic stability, we had to give her the antidote of cyanide poisoning, 5 grams of hydroxycobalamin, with the clinical improvement. Of course, it's our protocol when a patient comes in our unit, our BNCU unit. We have to go through a thorough assessment, which means we use point-of-care ultrasound. We could do bronchoscopies, so we can do the grading of the inhalation injury, and to make a plan of what happens next. On the first hours, the 19-year-old female needed descarotomy on her left hand. The other ones, they needed just surgical debridement and the use of an exoplate. It was a successful journey for the patients. And the 24-year female was extubated 1 week after admission. And 3 weeks after her admission, she was dispatched from our hospital. She was the luckiest of them. The other 2 that suffered more severe injuries and who had tracheostomies, we took off the tube after 4 or 5 weeks, and they were dispatched from our hospital after 2 months. The journey was successful. We are very proud to be part of this journey. And I think that when it has to be with health, in matters of health, the only way is cooperation, nothing else. So, thank you very much.
Thank you.
In conclusion, that we should draw from this panel institutional cooperation. Both the institution of the system and the healthcare system institutions should always be at the highest possible level. It takes investment in young staff that would be trained for this type of injuries and treatment of patients that have both severe injuries and burns and a combined type of injuries that require intense care. We have performed well in the triage and the selection of patients sent to the specialized facilities outside of the country, because the capacity of the institutions of our healthcare system back then were indeed tested. And between us, the colleagues, when we communicated, we sought free beds for new admission of patients. Solidarity was at the highest possible level, and the lessons learned have to be incorporated into the national strategy for coping with this type of disasters and tragedies. What should come next is provide support to all the injured, because they're yet to be rehabilitated and reintegrated into the system. Thank you.